Most people feel safer the moment a doctor says, let's run a routine test. It sounds responsible. It sounds preventive. It sounds like you're doing the right thing for your health. But after a certain age, that same routine test can quietly become the starting point of something far more dangerous than the disease it was supposed to catch. Not because doctors are trying to harm you, but because the system is built to keep searching, even when searching no longer helps. My name is Dr. Bianca. I've spent over 2 decades working in internal medicine, reviewing patient histories, watching outcomes not just in the clinic, but months and years after decisions were made. And what I've seen again and again is something most people are never told. After 70, the biggest risk is not always what's hiding inside your body. Sometimes the biggest risk is what happens after you go looking for it. Before I show you the 5 checkups I personally question or avoid recommending for patients over 70, you need to understand one critical concept. Because once you understand this, everything else will make sense. It's something I call the domino effect. Here's what that means in real life. You go in for a routine screening, you feel fine, no symptoms, just being careful. The test finds something small. Maybe it's a shadow, a borderline number, something unclear. Now your doctor can't ignore it, so you're sent for another test. That second test is more detailed. Maybe it's invasive. Maybe it involves contrast dye, radiation, or tissue sampling. Now the result shows something slightly abnormal. Not dangerous, not urgent, but not perfectly normal either. And now you've crossed a line. Because once something is labeled abnormal, it demands action. You're referred to a specialist. The specialist recommends a procedure. The procedure leads to recovery, complications, side effects, or limitations your body now has to deal with. And here's the part no one says out loud. Many of those original findings would never have affected your life at all. They would have stayed silent. You would have lived your years without ever knowing they existed. But because you looked, the process started. And once it starts, it rarely stops on its own. That is the domino effect. And after 70, your body does not recover from each step the same way it did at 50. Every intervention carries more weight. Every complication takes longer to heal. Every hospital stay increases risk. That is why the question is no longer just, can we detect something early? The real question becomes, does detecting this early actually help you live better or longer? Now let's go into the first checkup, a test that has become almost automatic in modern medicine. Full body imaging scans, you've probably heard of them. Sometimes they're marketed as advanced preventive care, a complete scan of your body to catch anything before it becomes serious. It sounds like the smartest thing you could do. See everything, miss nothing. But here's what actually happens. These scans are incredibly sensitive. They don't just find dangerous problems, they find everything. Tiny cysts, small nodules, benign growths, age-related changes that mean absolutely nothing. But the scan doesn't tell you what matters and what doesn't. It just shows something. And once something is seen, it has to be explained. That leads to more scans, more tests, sometimes biopsies, and every additional step increases risk. Radiation exposure, contrast reactions, invasive procedures, and the emotional toll of being told, we found something, but we're not sure what it is. I've seen patients who went in feeling perfectly fine, and within weeks they were living with anxiety, undergoing multiple procedures, all because of something that would never have affected them. After 70, your body will show changes. That is not disease, that is time. But full body scans don't distinguish between harmless aging and dangerous pathology. They simply open the door. And once that door is open, it's very hard to close it again. Now let's move to the second checkup. Routine thyroid screening in older adults without symptoms. This one surprises a lot of people because checking thyroid levels sounds harmless, just a blood test. Quick, easy, no risk. But the issue is not the test itself, it's what happens after. As we age, thyroid hormone levels naturally shift. Slight elevations or reductions are common. In many cases, they don't cause symptoms, they don't affect daily life, they don't require treatment. But when those numbers fall outside the standard range, even slightly, they often trigger a diagnosis. Subclinical hypothyroidism, mild thyroid imbalance, now medication is introduced. And that's where things become complicated because thyroid medication is not passive. It actively changes your metabolism, your heart rate, your energy balance. In younger patients, the body adapts quickly. In older adults, even small adjustments can create instability. Too much hormone can lead to heart rhythm issues. Too little leaves the patient unchanged but dependent. And once treatment begins, it usually doesn't stop. Regular monitoring, dose adjustments, more appointments, all for a condition that may never have caused a problem. I've seen patients who felt completely normal before, and months later they were dealing with palpitations and confusion, all from trying to correct what wasn't broken. This is where medicine becomes tricky, because normal ranges are based on populations, not individuals. And after 70, what is normal for you may not match what's printed on a lab report. Now let's talk about the third checkup: routine CT scans for lung screening in low-risk older adults. Again, this sounds like a life-saving tool. Find cancer early, act quickly, improve survival. And in high-risk individuals, especially heavy smokers, this can be valuable. But in low-risk patients over 70, the balance changes. Because CT scans don't just detect cancer, they detect nodules, small spots in the lungs that are incredibly common with age. Most of these nodules are harmless. They don't grow, they don't spread, they don't cause symptoms. But once they are found, they are monitored. Repeated scans every few months, watching for change. And with each scan comes radiation exposure, not massive in one instance, but cumulative over time. And if a nodule changes slightly, even if it's still harmless, the next step is often a biopsy, a needle into the lung, or even surgery. Now you've gone from feeling healthy to undergoing invasive procedures for something that might never have mattered. And here's the reality most people don't hear. Some slow-growing lung abnormalities in older adults progress so slowly that they would never impact lifespan. But once detected, they are treated aggressively because medicine is trained to act, not to wait. And that action can sometimes shorten quality of life rather than protect it. I want you to notice a pattern here. None of these tests are bad. They all have value in the right context. But after 70, the context changes. Your body is not the same. Your risks are not the same. Your priorities should not be the same. The goal is no longer just to find something early. The goal is to protect the life you are living now, not trade it for years of unnecessary interventions. In the next part, I'm going to show you 2 more checkups that create some of the most dangerous medical cascades I've seen, including one that often leads directly to surgery that patients never needed in the first place. And I'll give you the exact questions you need to ask before agreeing to any test, so you stay in control of what happens next. There is one more thing I need you to understand before we finish this conversation, because this is where most people get it wrong. They hear information like this and think the message is avoid doctors or say no to everything. That is not the message. The real message is much more precise. It is this: after the age of 70, the goal of medicine shifts. It is no longer about finding every possible abnormality. It is about protecting function, independence, and quality of life. And those 2 goals are not always the same. Let me show you what I mean. I had a patient named Eleanor, 76 years old, sharp mind, lived alone, cooked for herself. She walked every evening in her neighborhood. If you met her, you would not think of her as old. She came to me after a routine scan picked up a small abnormality in her kidney. She had no pain, no symptoms. If that scan had never been done, she would have never known. But now the system moved forward automatically. More imaging, then a biopsy, then a recommendation for surgery. The argument sounded reasonable. We caught this early. That is the logic most people accept without hesitation. But here is what I asked her. Eleanor, if we do nothing, what happens? The answer was uncomfortable. We don't know. It might grow. It might not. Then I asked the second question. If we do the surgery, what happens? Now the risks came out. General anesthesia, hospital stay, possible complications, weeks of recovery, loss of independence during healing. And suddenly, the situation looked very different because the problem she had was theoretical, but the risks were immediate and real. Eleanor chose to wait. We monitored. 6 months later, nothing changed. 1 year later, still stable. 2 years later, she was still walking every evening, still living her life, still independent. The abnormality never became her problem, but the surgery could have. That is the difference between detection and impact. Not every abnormality is a disease. Not every disease needs treatment, and not every treatment improves your life. After 70, those distinctions matter more than ever. Now, I want to talk about something even more important, because the real danger is not any single test. It is the mindset that drives them, the belief that more testing always equals better care. It feels logical, it feels responsible, but in older adults, it often leads to something called overdiagnosis. Overdiagnosis means finding conditions that would never have caused harm. And once they are found, they are almost impossible to ignore because now they have a name. Now they exist on paper. Now they demand attention. And that attention often leads to treatment, even when treatment is not necessary. This is how the cascade begins. And once it starts, it is very difficult to stop because every step justifies the next. Another scan, another specialist, another procedure, each one small, each one reasonable. But together, they create a path that can take away something far more valuable than what they are trying to protect. Your independence, your strength, your ability to live your life on your own terms. I have seen patients enter this system walking independently and leave it needing assistance for basic daily activities. Not because of their original condition, but because of everything that followed. That is the part no one prepares you for. Now, let me give you something practical, something you can use immediately, because information without action is useless. From this point forward, every time a test is recommended, I want you to slow the moment down. Do not say yes immediately. Do not say no immediately. Ask questions. Simple, direct questions. What problem are we trying to find? If we find it, what will we do about it? Will that treatment improve how I feel or how long I live? What are the risks of getting there? And most importantly, what happens if we wait? That last question is powerful because in many cases, the honest answer is nothing urgent. And if nothing urgent happens, you have time to think, time to get another opinion, time to make a decision that aligns with your life, not just the protocol. I want to be very clear about something. If you have symptoms, everything changes. Pain, bleeding, sudden weight loss, shortness of breath, neurological changes. Those are signals that need investigation. Those are not situations for waiting. Those are situations for action. What we are talking about here is different. We are talking about testing in the absence of symptoms, testing based on age alone, testing that starts chains of events without clear benefit. That is where caution matters. That is where awareness protects you. Let me tell you about another patient. His name was Richard, 79, strong man, former builder, hands like stone. He came in because he was told he needed a routine heart test before a minor procedure. He felt fine, no chest pain, no breathing issues, nothing. The test showed a possible abnormality, so he was sent for a more invasive procedure. That procedure caused a complication. That complication led to a hospital stay. The hospital stay led to weakness. The weakness led to a fall after discharge, and that fall changed everything. He never fully regained his previous level of independence. All of this started with a test he did not need. Not because the doctors made a mistake, but because the system followed its usual path. And his body, at 79, could not tolerate that path the way a younger body could. This is the reality that needs to be understood. Age changes the equation, not slightly, fundamentally. What was low risk at 50 is not low risk at 75. What was preventive at 60 can become harmful at 80. And yet the system often continues as if nothing has changed. That is why you have to be the one who asks the questions. That is why you have to understand the bigger picture. Because no one else is living in your body, no one else is carrying the consequences of these decisions. Now, I want to leave you with something important. Because this is not about fear, it is about control. You are not powerless in the medical system. You are not just a passive participant. You are the decision maker. Your doctor provides information, they offer recommendations, but the final decision is yours. And that decision should always be based on one simple principle. Will this help me live better, not just longer? Because living longer without independence, without clarity, without strength, is not what most people actually want. And yet that is exactly where unnecessary interventions can lead. So here's what I want you to do after this. Think about your last medical test. Why was it done? What was the outcome? Did it change anything meaningful in your life? Or did it just create more steps, more follow-ups, more uncertainty? Write that down because awareness starts there. And if you have an upcoming test scheduled, don't cancel it blindly. Have the conversation, ask the questions. Understand the purpose, make the decision consciously. That is how you protect yourself. That is how you take control. And that is how you avoid becoming part of a system that sometimes forgets the difference between helping and overdoing. If this message reached you at the right time, share it with someone who needs to hear it. Because there is someone in your life right now, a parent, a relative, a friend, who is saying yes to everything simply because they trust the system completely. And trust is good, but informed trust is better, much better. I am Dr. Hale, and my goal is not to make you afraid of medicine, it is to make you strong inside it. Because the strongest patients are not the ones who say yes to everything. They are the ones who understand when to say yes and when to pause. Take care of your health, protect your independence, and I will see you in the next conversation.